I am joined by author and health expert William Smith. William, thanks for joining me.
Yeah, thanks, Brian. Appreciate it. Great opportunity.
Well, I want to get your input and your perspective on people working from home. We're in the middle of a pandemic here. I'm speaking to you in August of 2020, and not only are we looking towards another school semester with lots of people staying home, both students and parents working from home, but we've been going through several months now of lots of people having to shift from working out in the world to operating at home. So I'd like your perspective. I know you have a lot of information to share. Let me know what your thoughts are.
To set the tone, we have to kind of bucket a remote worker and somebody who's telecommuting. Because I think the gig economy has pushed remote workers, whether it's freelancers, contractors, you have sites like Guru, Upwork, all these different publishing sites and creative content sites, Udemy, Teachable. They're supporting a group of people who are usually non-employed contract freelance workers who have been and used to being worked from a remote setting for many, many years. So this COVID situation that we're all in right now may have not had as dramatic of an effect upon the way they're living their life. Now, the telecommuters, that's a whole other category. Those are usually employed people. They are usually exempt for the most part, salaried employees that work at large companies, let's say in the state of New Jersey or abroad. A large percentage of exempt or full-time employees at companies are telecommuting for the first time. And I would just add some statistics to that to support that. Again, this trend has been going on for years, but the gig economy coupled with, unfortunately, COVID has pushed this seismic change at a much more rapid rate than anybody could have expected. In 2005, I think there was to now about 173% increase in people working remotely. In 2017, there were about 8 million people working remote consistently in the United States. And I think this latest statistics that I found by 2020, and this is for employed, those who are telecommuting, not a kind of gig remote worker, it's going to be about approximately half the U.S. workforce at some point this year, early into next year, that will be telecommuting to some degree.
Wow, it's amazing. And thank you for pointing out that difference between a remote worker and telecommuting. Tell me a little bit about challenges that people may run into as they're working from home, maybe for the first time.
So I think there's, when it comes to challenges, there's so many challenges. I think the initial challenge of working at home, especially for the first time, is your schedule and how you get your mind around that. You get up in the morning. A lot of people are used to, it might be going to the gym, getting their kids breakfast. I'm just thinking about my day, right? And I've seen the challenges such as childcare. By far, that's for working families in this day and age with two working parents, by far one of the most difficult things. And I speak personally to that. I think another challenge is the schedule. We are not given as many boundaries anymore. I think when the telecommuting idea, and now with technology, there's an expectation, whether it's written or informal, that you are available more than maybe what you used to, because the common logic is, well, I'm not in the car 2 hours commuting every day. So I think the boundaries and the childcare are two things that jump out to me right away.
Let me drill into that a little further. An area of your expertise specifically would speak to posture and physicality or physiology. Can you tell me a little bit about your perspective on that?
Well, first and foremost, for those people who are working remote for the first time, at telecommuting, undoubtedly they're not going to have a proper work setup at home. That's just the fact of the matter. Even in office, it's extremely expensive. And I tell you, for large employers, musculoskeletal claims are undoubtedly year after year one of the top spends and one of the top claims, right up there with cancer and other types of claims that go along with in their insurance plan. So you can anticipate, like the day is long, that there's going to be a spike in musculoskeletal claims within the next year or two. And they're seeing that because, number one, COVID has prevented a lot of people from getting the needed preventative care they need. And then that's going to drip over into insurance premiums, which are going to spike and roll over into what an employee pays from their healthcare plan. So if there are suggestions I can make from that perspective at working at home in terms of posture, it's not sitting, set a timer on your computer, for a period of time. That's a great tip. I do that every 15 or 20 minutes. I'll stand up, move around a little bit. That's just my trainer brain going off too. I think secondly too, you need to have a proper office setup as much as you can. Make sure your chair height is correct. There's a small or slight flex and extension in your knee. Make sure your hips are slightly above the height of the knees. Make sure your feet are flat on the floor.
What about people, working at home, but also we got these devices in our hands? And do you have any input on that too?
When you're looking down at a smartphone, the first and foremost, you shouldn't be looking at that for more than 30 or 45 minutes before bedtime. It's going to keep your brain awake.
Oh, that's a good one. Hold on, that's not a posture detail. Tell me that again, please.
Well, in some ways it is, because depending on where you're looking at it, right? So if you're looking at it like this, if you're standing up, but the tip I just cited was you really should let your brain rest. Your brain is like many other muscles or organs in the body, is that it does need to rest. And your optic nerve, which connects into your eyes, contributes to about 10 to 15% of your overall balance. So this whole thing up here gets really tired, right? And so about 30 to 45 minutes before you go to bed, you shouldn't be staring at your PDA or your smartphone. It will keep you awake, and it will keep you stirring for probably a good hour or two before you actually get into a restful REM sleep.
Amazing. That's an incredible detail to share. We could talk for hours. Where can people find more information about you and your published works and connect with you?
So you can find me on Amazon, Exercise for Perfect Posture. I think that's the appropriate theme for today's discussion. You can also find me on Hatherleigh Press's website. They have a wide variety of amazing books that are great resources. I would add another book too, Exercise for Sciatica, which just came out and is trending very well. I write all my books or co-author them with many doctors and physical therapists. So I recognize where my scope of practice ends, where another one begins. And I look forward to sharing that knowledge with whoever would like to contact me.
William Smith, author and health expert, thank you so much for joining me today.
Thank you so much. I appreciate the opportunity.